So bispecific antibodies have been an exciting development in the field of lymphoma, with very promising response rates in the initial clinical trials, 60% overall response rates with about 40% of patients achieving a complete response. Real world data, the responses are a little bit more limited, and the median duration response even in trials is only about 5 months. So, while complete responses are very durable, most patients are not having the benefit of these treatments, or at least not long-term benefit. There's many factors associated with lack of response, and we're kind of figuring that out, and there's a lot of different reports with not one consistent message, but several of them are immune dependent. So multivirus specific T cells are allogeneic T cells that we produce by taking whole blood PBMCs, and then we activate them to viral peptides and expand them ex vivo. Because they're expanded towards virus antigens, so we use EBV, CMV, BK virus, and adenovirus, they're selected towards these viruses, and we don't see graft versus host disease in hundreds of treated patients that we've treated for viral infections. And these T cells have immediate effector function, so they have a lot of cytokine secretion and expansion, more so than we would see with regular PBMCs. What we looked at was basically in test tubes and in vitro experiments, we evaluated their efficacy and their expansion compared to whole blood PBMCs, and we found that there's about a 86-fold expansion of activated T cells, so that's using CD25 as a marker of activation. Compared to regular PBMCs, we have about an 8-fold expansion. So significantly more T cells, more expansion. And then when it comes to cytotoxicity, when we looked at BJAB lymphoma cells, we found that at a 1-to-1 ratio, PBMCs decreased the number of lymphoma cells by about 33% by day 1, but then the tumor cells outgrew the antibody. However, when we use the MVSTs, by day 1 we had about a 45% decrease, and by day 2, 95% of the tumor cells were gone. So we're seeing, at least in these very, very initial preliminary experiments, a lot more cytokine secretion, activation, expansion, and cytotoxicity. So I think very promising. Further studies, these prelim data, more research needs to be done, but I think an approach to maybe help us really move these antibodies to help benefit more patients.